The trust is unique in that we are psychologists helping psychologists, and I don't think there's another liability insurance company out there who does that. We know what it is like to sit in the chair and to provide care to somebody and what those risks are like, and we're the only ones who can do that.
We all have not only the legal experience, but also the clinical experience, and that really adds a kind of nuance and sophistication that isn't found elsewhere.
The Trust has the Risk Management Advocate Program. We have 7 people who are experienced psychologists and have legal backgrounds. Some of us are attorneys. You can just call unlimited and have 20-minute consultations, ask as many questions as you want, call as many times as you need. And it's a source of expertise that you just don't have available otherwise.
Risk management is, to use Eric Harris's wonderful line, the prospective assessment of a retrospective evaluation. Essentially, that means that we try to take the perspective of what an evaluating body like a board or ethics committee or a group of colleagues would think 6 months, a year, 2 years in the future about the choices we're making now in our professional practices.
We did some research to look at over 70,000 calls we've done in almost 25 years at this point in the risk management program. And what we did was take a sample of that and just try to get a sense of what are truly the most common issues that folks face, that we get questions and calls about. And so the main ones that we focused on were multiple relationships and boundary issues, termination, being asked to take on different roles like writing letters for legal purposes, working with high conflict families was another one, and then interjurisdictional practice question.
Folks are clinically well trained, but the nuts and bolts and the risks and the stuff that you don't learn in grad school is the kind of stuff that you can learn in workshops like this.
The workshops provide both an overall strategy of risk management so that they can apply it to whatever it is they're doing in their day-to-day life, but it also helps them think of things that they haven't thought of before.
Trust your own gut. When you feel like something is going wrong or when you feel like you have a question, ask the question, consult with somebody. We can't do it in a vacuum. You need to ask, you need to know what other people would do and get some other opinions and a reality check. And that's, I think, a big piece of risk management, no matter what the conundrum is that you found yourself in.
These are difficult situations that we face in our work, and it's really important not to go it alone. And so we're here for that reason, and we're a confidential service to really just make sure that you have a place to be able to talk through these difficult situations, because sometimes you're not able to with colleagues or in other contexts and know that you have confidentiality. So I just encourage you to take advantage of it. We're here to help.
I know that our staff, whether it's our risk management consultants, our insurance service representatives, our operations team, our IT team, they're all very dedicated to psychologists. And they admire and respect the fact that psychologists' livelihood is to help other people. And that energizes them to help psychologists. We want to take the worry away so they can focus on helping other people, focus on doing what they do best and allowing us to do what we do best.